Scapular region. Introduction. Scapular region is defined by the muscles that attach to the scapula. It also comprises of structures which are closely related to and which surround the shoulder joint. Surface landmarks. The greater tubercle of the humerus forms the most lateral bony point of the shoulder. A gross triangular outline could be seen which presents the following boundaries. Its base, which is placed internally, is constituted by the vertebral margin of the scapula. Its apex, placed externally, becomes continuous with the region of the shoulder joint. Inferiorly, it is limited by the lower oblique edge of the latissimus dorsi muscle, which likewise separates it from the region of the axilla, and above, the superior costa of the scapula constitutes its extreme boundary and separates it from the posterior triangle of the neck. The skin covering the scapular region. Muscles of scapular region. Most of them are scapulohumeral muscles. As the name suggests, these scapulohumeral muscles arise from the scapula and moves to the humerus for insertion. These muscles act on the glenohumeral joint. They're also called as intrinsic shoulder muscles. There are 6 in number, namely deltoid, supraspinatus, infraspinatus, teres minor, teres major, subscapularis. Supraspinatus, infraspinatus, teres minor and subscapularis muscle forms a cuff around the shoulder joint. Hence, they are called as rotator cuff muscles. Deltoid. It is 3-in-1 muscles, that is, they arise in 3 fibers. It is thick, powerful and curved triangular muscle covering the shoulder and forming its rounded contour. It is shaped like the inverted Greek letter delta, 8. Hence, this muscle is named deltoid. Acromial part of deltoid is example for multipinnate muscle. Many fibers arise from 4 septa of origin that are attached about to the acromion. The fibers converge onto 3 septa of insertion which are attached to the deltoid tuberosity. Origin. The anterior part or clavicular part arises from the upper surface and anterior border of lateral 1/3 of the clavicle. The middle or acromial part arises from lateral margin and upper surface of the acromion. As described before, these fibers are multipinnate in nature. The posterior or spinous part arises from the lower lip of the crest of the spine of the scapula. Insertion. The fibers converge to form a short thick tendon which is inserted on the V-shaped deltoid tuberosity of the humerus. Nerve supply. Deltoid muscle is supplied by the axillary nerve which has a root value of C5-C6. Actions. The anterior clavicular fibers flex the arm at the shoulder by moving the arm forward from anatomical position, and it also produces medial rotation of the arm by turning the anterior surface of arm towards midline. The posterior spinous fibers extends arm at shoulder and produces lateral rotation of arm by turning the anterior surface of arm away from midline. The middle acromial fibers are the strong abductor of the arm from 15° to 90°. When all its fibers contract simultaneously, the deltoid is the prime mover of arm, producing abduction along the frontal plane. The deltoid muscle is more powerful and acts better when the arm is medially rotated. This makes the deltoid of antagonist muscle of the pectoralis major and latissimus dorsi during arm adduction. Structures under cover of deltoid muscle. Bones, the upper end of humerus, the coracoid process of scapula. Muscles. Muscles attached to the upper end of humerus and coracoid process of scapula are under cover of deltoid muscle. Insertions of pectoralis minor on coracoid process of scapula. Supraspinatus, infraspinatus and teres minor on greater tubercle of the humerus. Subscapularis on lesser tubercle of humerus. Pectoralis major, teres major and latissimus dorsi on the intertubercular sulcus of the humerus. Origin of coracobrachialis and short head of biceps brachii from coracoid process. Long head of biceps brachii from the supraglenoid tubercle. Long head of triceps brachii from the infraglenoid tubercle. The lateral head of triceps brachii from the upper part of posterior surface of the humerus. Vessels. Anterior circumflex humeral. Posterior circumflex humeral. Nerve. Axillary nerve along the surgical neck of humerus. Joints and ligaments. Musculotendinous cuff of the shoulder joint, thoracoacromial ligament. BURSAE. All bursae around the shoulder joint, including the subacromial or subdeltoid bursa. Supraspinatus. Origin. It arises from the medial two-thirds of supraspinous fossa of the scapula. Insertion. The fibers pass forward and converge under the acromion into a tendon, which crosses above the shoulder joint and is inserted onto the superior facet or upper impression on the greater tubercle of the humerus. Nerve supply. Supraspinatus is supplied by suprascapular nerve, which has a root value of C5, C6. Actions. Supraspinatus initiates the abduction of arm at shoulder. It is responsible for first 15 degree of abduction of shoulder and assists the deltoid in carrying abduction thereafter, that is, from 15 degree to 90 degree. It helps to resist the inferior gravitational forces placed across the shoulder joint due to the downward pull from the weight of the upper limb. The supraspinatus also helps to stabilize the shoulder joint by keeping the head of the humerus firmly pressed medially against the glenoid fossa of the scapula. Infraspinatus. It is thick, triangular muscle which occupies most of the infraspinous fossa. Origin. It arises from the medial two-thirds of the infraspinous fossa by tendinous fibers from ridges on its surface. Insertion. Fibers of infraspinatus converge to form a tendon which passes across the posterior aspect of the shoulder joint to be inserted on middle facet of greater tubercle of the humerus. Nerve supply. Infraspinatus is supplied by suprascapular nerve, which has a root value of C5, C6. Actions. Lateral rotation of the arm. When the arm is fixed, it abducts the inferior angle of the scapula along with teres minor and the deltoid. Teres minor. teres minor. Origin: upper two-thirds of the dorsal surface of the lateral border of the scapula. Insertion: lowest facet on the greater tubercle of the humerus. Nerve supply: axillary nerve which has a root value of C5, C6. Actions: abduction and lateral rotation of arm. Along with the other rotator cuff muscle, teres minor stabilizes the shoulder joint. Teres major. Origin: lower one-third of dorsal surface of lateral border of the scapula and partly from dorsal surface of the inferior angle of scapula. Insertion: fibers run superiorly and laterally to insert onto the medial lip of intertubercular sulcus or bicipital groove of the humerus. Nerve supply: lower subscapular nerve which has root value of C5, C6. Actions: adduction and medial rotation of the arm. Also assist in arm extension. Subscapularis. Subscapularis is a bulky multi-pinnate muscle that fills up the subscapular fossa of the scapula. This muscle forms the posterior wall of axilla. Origin: medial two-thirds of the costal surface of the subscapular fossa of scapula. Insertion: the subscapularis muscle converts into a tendon which passes anterior to the capsule of the shoulder joint. This tendon inserts into a lesser tubercle of the humerus. Nerve supply: upper and lower subscapular nerves which has a root value of C5, C6. Actions: medial rotation of the arm. It also assists in adduction of the arm. Rotator cuff, musculotendinous cuff. Musculotendinous cuff of shoulder is a fibrous sheath formed by 4 flattened tendons which blend with the capsule of the shoulder joint and strengthen it. The muscles which form the cuff arise from the scapula and are inserted into the lesser and greater tubercles of the humerus. They are the subscapularis, the supraspinatus, the infraspinatus, and the teres minor. The tendons, while crossing the shoulder joint, become flattened and blend with each other on one hand and with the capsule of the joint on the other hand, before reaching their points of insertion. The cuff gives strength to the capsule of shoulder all around except an inferior part. This is the reason why most of the shoulder dislocations occur in downward direction. Subacromial bursae. Subacromial bursae are the largest bursa of the body, situated below the coracoacromial arc and the deltoid muscle. The tendon of the supraspinatus and the greater tubercle of the humerus are deep to the bursae. The subacromial bursa is of great value in the abduction of the arm at the shoulder joint. It protects the supraspinatus tendon against the friction with the acromion. During overhead abduction, the greater tubercle of the humerus passes under the acromion, that is facilitated by the presence of this bursa. Posterior scapular region. This region comprises of gaps between the muscles of posterior wall which form the apertures through which structures pass between the axilla, posterior scapular region and posterior compartment of the arm. Quadrangular space. This provides passage between axilla and more posterior scapular and deltoid region. Boundaries of quadrangular space. Superiorly by inferior margin of the subscapularis muscle from anterior aspect, teres minor muscle in the posterior aspect. Laterally by surgical neck of humerus. Inferiorly by superior margin of the teres major muscle and medially by lateral margin of the long head of the triceps brachii muscle. Contents: axillary nerve and posterior circumflex humeral artery and vein pass through this space. Upper triangular space. This provides passage between axilla and posterior scapular region. It's formed by superiorly by inferior margin of teres minor, inferiorly by superior margin of teres major muscle. Base formed by medial margin of long head of triceps brachii muscle and apex formed on the lateral margin of scapula by a point where teres minor and teres major muscles meet. Contents: circumflex scapular artery and vein winds around the lateral margin of the scapula in this space. Lower triangular space. This is formed by medially by lateral margin of the long head of the triceps brachii muscle, laterally by shaft of humerus and superiorly by inferior margin of teres major muscle. Contents: radial nerve and profunda brachii vessels passes out of axilla to reach the spiral or radial groove and enters the posterior compartment of arm. Axillary nerve. Axillary nerve is also called as circumflex nerve as it surrounds the surgical neck of humerus. It is important nerve since it supplies the deltoid muscle which is main abductor muscle of the arm. Origin. Axillary nerve is a branch of posterior cord of the brachial plexus. Root value. Ventral rami of C5, C6. Course and relations. The nerve lies at first behind the axillary artery and in front of the subscapularis. It passes downward to the lower border of subscapularis muscle. It then winds backward in company with the posterior humeral circumflex artery through the quadrangular space. In the quadrangular space, the nerve is related to the boundaries of the space, that is, superiorly to teres minor and subscapularis, inferiorly to teres major, medially to the long head of triceps brachii, and laterally to the surgical neck of humerus. Branches. Motor branches to deltoid teres minor. Sensory branches to skin of the upper lateral arm. At quadrangular space, nerve divides into an anterior, a posterior. The anterior branch, upper branch, winds around the surgical neck of the humerus, beneath the deltoid muscle, where it is accompanied by the posterior circumflex humeral vessels. It continues as far as the anterior border of the deltoid to provide motor innervation to deltoid. The anterior branch also gives off a few small cutaneous branches which pierce the muscle and supply in the overlaying skin. The posterior branch, lower branch, supplies the teres minor and the posterior part of the deltoid. The teres minor muscle is innervated by this nerve where it forms a pseudoganglion. A pseudoganglion has no nerve cells but nerve fibers are present. Damage to the fibers innervating the teres minor is clinically significant. The posterior branch pierces the deep fascia and continues as a superior or upper lateral cutaneous nerve of the arm, which sweeps around the posterior border of the deltoid and supplies the skin over the lower 2/3 of the posterior part of this muscle, as well as that covering the long head of the triceps brachii. The trunk of the axillary nerve gives off an articular filament which enters the shoulder joint below the subscapularis. Anastomosis around scapula. Blood is brought to the scapular region by a network of arteries which form the scapular anastomosis. This anastomosis is seen at two sites. Anastomosis around the body of scapula, anastomosis over the acromion process, anastomosis around the body of scapula. The anastomosis occur in the three fossae, subscapular, supraspinous, and infraspinous. It is formed by the suprascapular artery, a branch of the thyrocervical trunk, the deep branch of the transverse cervical artery, another branch of the thyrocervical trunk. The circumflex scapular artery, a branch of the subscapular artery which arises from the third part of axillary artery. Note, this is an anastomosis between branches of the first part of the subclavian artery and branches of third part of the axillary artery. Anastomosis over the acromion process. It is formed by the acromion branch of the thoracoacromial artery, a branch from second part of axillary artery. The acromial branch of the subscapular artery, a branch from first part of the subclavian artery. The acromial branch of the posterior circumflex humeral artery, a branch from third part of axillary artery. Note, this is an anastomosis between the first part of the subclavian artery and branches of second and third parts of the axillary artery. Clinical importance. The extensive arterial anastomosis at the scapular region provides a collateral circulation. So, if one vessel is blocked or damaged, many others can provide blood to the region. This anastomosis helps preserve the upper limb during injury. Muscles medial and superior to the scapula receive blood from the dorsal scapula, transverse cervical and suprascapular arteries, which are branches of the subclavian artery, and also from the acromial artery, which is the branch of the axillary artery. Muscles anterior and lateral to the scapula are supplied by the subscapular, circumflex scapular, and posterior circumflex humeral arteries, which are derived from the axillary artery. Joints of the scapular region. Joints of the scapular region are as follows: acromioclavicular joint, coracoclavicular joint, shoulder joint, sternoclavicular joint. These joints would be dealt in shoulder girdle topic in detail.